case of seizures as a presenting symptom for leptomeningeal myelomatosis. Our patient was a 63-year-old male who presented for new-onset seizures and left-sided hemiparesis. He had a history of IgG multiple myeloma on Revlimid chemotherapy, as well as a history of DVT and multiple pathologic vertebral compression fractures. This patient was obtunded on admission and was intubated and sedated in the emergency room due to airway concern during his seizure activity. He had no other medical or surgical history. Social family history and allergies were non-contributory, and his only medication was Percocet. You can see here his vital signs showed that he was hypertensive, but otherwise unremarkable, and physical exam was unremarkable other than that he was intubated and sedated and appeared cachectic with a Foley catheter in place. Labs were unremarkable as well, except he was noted to have a beta-2 microglobulin of 1.5 and an albumin of 2.2. The CSF, we had a lumbar puncture was done, and CSF showed malignant plasmacytosis with heavy involvement of the plasmacytoid cells, compatible with leptomeningeal myelomatosis. The imaging we have a chest x-ray and CT thorax displaying a right upper lobe lesion of about 8 by 9 by 12 centimeters, extending from the right hilum to the apex with no adenopathy, infiltrates, or PE. We also had an abdominal CT, which was unremarkable, a head CT, which was unremarkable, a chest MRI with no acute pathology, and an echo with a normal ejection fraction and no evidence of DVT on ultrasound. The patient was started on levetiracetam and lacosamide for seizure prophylaxis, but unfortunately he developed aspiration pneumonia and acute hypoxic respiratory failure and was discharged to hospice care. He did have EEGs done during his stay at our facility, which showed evidence of seizure activity in the left temporal lobe, as well as generalized slowing and encephalopathy on the follow-up EEG. As you may know, multiple myeloma is a B-cell malignancy, typically it'll present involving the bone or the soft tissues. You'll find a lot of vertebral fractures, hypercalcemia, and these vertebral compression fractures are, of course, pathologic fractures. Very uncommon to have direct CNS involvement, and even less common to have leptomeningeal involvement, as this patient did. He did appear to be in remission with, but of course he presented with this isolated relapse. The international staging system was developed to determine prognostic indicators based on beta-2 microglobulin and albumin levels. Our patient was a stage 2, which correlates with a 3 to 4 year life expectancy. But unfortunately, our patient's course was much more accelerated than that. So given this case, it's important to maintain a high index of suspicion so that treatment can be initiated earlier, as it's associated with a longer life expectancy and, of course, better outcomes. Thank you.